Today is the Vice President of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Courtland, welcome back.
Thank you.
Happy holidays.
Thank you for that too.
Yes. So I mentioned a few moments ago, half of our staff is out sick, and we think it's respiratory based on the symptoms, but I guess it's what we expect as the temperature drops and people cluster indoors.
Yeah, that's exactly right. It's we're definitely back in the meat of respiratory virus season now, and hospitals gotten busy again with those types of cases. And there's a variety of viruses that cause it, but the big ones that make people really sick are obviously COVID, influenza, which I think people kind of forget about, the flu, a lot of flu hospitalizations, and then RSV, and then there's various things that cause pneumonia. It's usually bacterial pneumonia, but a number of things cause pneumonia. So I was actually looking earlier today at some of the numbers. So on a regular kind of winter day, the hospital may have 220 to 250 people that are admitted, and so right now about 50 of those are respiratory. Basically viral type situation, either pneumonia or COVID. About 25, so half of those are COVID, the other half are some type of pneumonia. So,
It sounds high.
Yeah, 25%, 20% of the hospital is full of what are basically vaccine preventable, mostly vaccine preventable conditions. So there's a lot of people that are, that are in there that really don't need to be. And so sometimes you can't avoid it. People get vaccines and obviously still get sick, but the majority of those, if they are vaccinated, are much less sick and usually don't require hospitalization. Yeah.
And both one respiratory virus in particular, RSVP, that there is a vaccine for that, and obviously COVID.
There is now. Yeah, RSV is a new vaccine. So this has really been the first year that that's been available for the full season. And there's a version that's for kids. There's a version for pregnant moms, which is new. And then the 60 and over adults also have access to that. And then obviously the flu has been available for years, and obviously we have the COVID vaccine available for years. And we have a pneumonia vaccine that's been available for a very long time. And the pneumonia vaccine is also for very young kids and then also for adults. Early
adopters with the first COVID vaccine by far were people over 60, 65.
Yeah.
80, 90% of that population, they couldn't wait to get the vaccine.
Right.
Now with RSV, according to the New York Times, only 15% of people 65 and over have gotten the RSV shot.
Yeah.
What do you make of that?
I don't think it's as well publicized. I don't think people think it's not as top of mind, obviously, as COVID was. I think when the entire world is shut down because of a virus, people are a little more scared, and I don't think folks are as concerned about RSV or pneumonia. I mean, that's another one that there's the main cause of pneumonia is streptococcal. It's a bacterial pneumonia, but that puts a lot of people in the hospital every year. It's very common, and the vaccine rates in this community are 60-ish percent, 65%. Which really isn't high enough. I mean, we'd want to see much higher numbers of people that are in that age category, in the 65 and over especially, that have got that vaccine. All these vaccines prevent the really bad outcomes, which is where we want to be, right? We want to be preventing those really bad outcomes, not dealing with them in the hospital.
Well, I think the word people feel, the word on the street is that, COVID is not as bad as it used to be.
Yeah.
So, same with RSVP, it's like the flu, you get sick, you feel crummy for a few days. It's not enough of an incentive to get the vaccine.
Yeah. I don't quite understand that. I think that, it might be I have a different perspective. I mean, if you see folks that are in the hospital, you see how miserable they are, then it might be a little more incentive for people to want to avoid it. I wouldn't think of death as the outcome as a thing I'm really trying to avoid. I mean, once you once you get sick like that, it's really hard to recover, and it takes a long time. It's very disruptive to your life. So I don't know. I think it's an interesting sort of perception that we have, I think, towards hospitalization as not being that bad, but it's pretty bad. You don't really want to be in there.
Or how can I avoid death
Yeah.
because it's still killing people?
Yeah, that too. Yeah, it just sort of added to the mix, right? So before we still had RSV and flu and pneumonia, and now we have those plus COVID. It's not like we have less of the other things, right? It's all sort of additive, right?
So vaccines for flu, COVID, and RSV, they're all available right now, and you're recommending all of them for everyone.
Yeah, and basically, it's a little different for RSV, but for the others, for flu, pneumonia, and for COVID, they really start being available starting for kids at 6 months, and then it's the 65 and over population where it's really important.
It seems like there's a new symptom or a symptom that might be the most prevalent with flu and particularly COVID is fatigue. And I remember that for me and people that I've talked to, it's like, oh my gosh, I just can't, when's this ever going to end?
Yeah, I think one of the most difficult things for people, so first of all, I think we have collectively, culturally, in this country, people are like, oh, I'm a little sick, I'll still come to work, or I'm a little sick, I still want to see people, right? We really need to reorient our mindset there. Like, I think that if people are sick, you should stay home, right? And whether that's fatigue, or whether that's a runny nose, or whether that's my throat is sore, whatever, like, just don't expose other people to it, right? Like, there's no reason to go to a gathering where people are sharing food, or to go to work where you're in close proximity with people if you're sick. Especially a lot of us now have like the kind of more work remote type abilities. And that really goes for the holiday gatherings where people are all going to get together and want to see each other, right? It's that time of year. But one person comes over kind of with the sniffles, and then everybody ends up getting COVID. And it's really harder now to understand which symptoms. It used to be that, I lost my sense of smell, so this is COVID, right? Mm-hmm. That happens now in a percentage of cases, but not like it used to as the virus has evolved. And so it's really important for people to be really aware of if you have any symptoms at all, in which case go take a test, right? Like go test. Like, don't wonder what you have, or don't say, oh, it's not COVID. You don't know. And I even see this with physicians, right? I mean, it's people with a lot of experience, and will say, oh, okay, well, it looks like, it's strep throat, right? Because I've seen this for, a long time. It's like, well, you don't know that really until you test it. COVID kind of masquerades as too many different symptoms, and you really have to have a test to know. And the tests are pretty good. They're pretty good at picking it up. If actually the way the FDA says it is, if you have a test and it's negative, but you have symptoms, right? You have a sore throat, or you're fatigued, or a little runny nose. If you have the test and it's negative, but you are still sick, you should repeat it 48 hours later, because those tests pick up the disease about 65% of the time if it's there. Those over-the-counter tests, right? They're still not as good as the ones we do at the hospital, right? That are the molecular tests.
The over-the-counter tests, the ones made in China.
Yeah, probably, yeah. Mm-hmm. But if you have symptoms and it's negative, it doesn't 100% mean you don't have it. You should really try to test again. And in the meantime, like, just don't spend a lot of time with other folks, right? Like, don't expose other people if you don't know what you have.
Yeah, so all those things you mentioned, strep, RSV, COVID, flu, pneumonia, these are all easily transmissible.
Easily, yeah.
Just by being in the same...
Yeah, being in the same room, talking to people, we all sort of, we all aerosolize a little bit when we talk, more when we laugh. And so that gets into other people's faces, and then we spread viruses. So that's what happens.
Yeah, and I think we're, when people call and they say, hey, I can't make the party, I'm coming down with something, no, I don't think we're at the point where we're saying, oh, come on, just come for a few minutes.
Thank you. Yeah.
Yeah, thank you. Thanks for
Yeah.
staying away.
Yeah.
And it's a party you don't want to go to. It's a perfect excuse. People will take that excuse, and you're off the hook. All right, Christmas. What do you think? Are there some good ideas for health and fitness that are good Christmas ideas for people?
Good Christmas ideas. Boy, that's a tough question, actually.
Well, how about this?
Yeah.
I've been seeing these cardio cards. You buy the card, you hold it to your wrist or something, or it's on an app, your phone. There are heart trackers or sleep trackers or cardio trackers. Are any of these things good ideas?
There are almost countless wearable devices that track various different things, right? You can do like a sort of 1 lead EKG with with an Apple Watch. I have one of those watches too, right? That'll tell me how my sleep is and things like that. I think, the thing that I think is interesting, there's actually been a lot of different studies using wearable devices in a lot of different environments. And the thing that I think is actually probably the most compelling reason to use one is because it's sort of a behavioral assist device, right? You're paying attention to it, and it's sort of a coach to help you. Like sleep, for instance, is a good thing, right? It's like people may not be thinking as much about their sleep, but when they have a device starts to track it, then they start to look at what are the ways in which I can improve my sleep. So screen time right before bed, drinking things with caffeine in the afternoon, and they start paying attention to those things and realizing that it influences their heart rate while they're sleeping, which is an indicator of their sleep quality.
Mine, it'll tell me, and I suppose I can set this up, but out of the box it has things like you need to stand up now.
Yeah.
It'll just tell you you've been sitting too long. Yeah.
Yeah. I guess you could do that during the show if you had to. Yeah.
During the breaks,
Yeah.
I'll stand up. But people like sleep, for example, people have discovered from sleep trackers that they might have sleep apnea.
Yeah. Yep. Yeah, sleep apnea. That's a whole other conversation. But yeah, sleep apnea I think is pretty grossly underdiagnosed. There's a lot of folks that have that, and it drives up blood pressure, increases risk for heart disease, stroke, all kinds of bad outcomes. It's something that needs to be treated. The number one treatment is actually weight loss. That's actually something that as people gain weight and they sort of gain soft tissue in their neck, that's how it sort of narrows the opening there, and so folks have a little bit harder time breathing at night when all the muscles relax. And so, as in many things, exercise and weight loss are really some of the best treatments.
Well, and most people have that app on their bathroom floor, the scale.
Yeah, that's true. Yeah, which also works. Yes, time tested, tried and true.
Mm-hmm.
But yeah, there's all kinds of devices out there people can wear, but I think it's really more about people making. So there was a great study that was done almost 10 years ago now, where they looked at county health data and tried to figure out what are the primary drivers of people's health outcomes, right? So what's making people sick? And it was broken into 4 categories: social, behavioral, clinical, and environment. So social is the things like income level and ability to read, and sort of the and then behavioral is our choices, right? Like, do we choose to smoke, or do we choose to exercise, right? Clinical is the stuff we do, right? And then environment is obviously the environment we're in, right? So are there chemicals we're exposed to? What kind of place do we work in? So social accounted for about 50% of outcomes. Behavioral accounted for another 30%. So now 80% of people's health outcomes are really based on, sort of these, factors in which they exist, right? And choices that they make. And
80%.
80%.
Wow.
Clinical was about 10 10 to 12%. So the doctors made very little difference actually. And the other 10, 5-10% was environmental, right? People's work environments and things they're exposed to. So people actually have a lot of control over their health outcomes. And so things like, if a fitness tracker helps somebody reinforce good behaviors, those behaviors are influencing, 30-40% of overall health outcomes.
Yeah, so driving over the speed limit, driving without a seatbelt, texting and driving, those are behavioral.
These are behavioral, these are choices people make that influence their health outcomes, right?
Makes sense.
Yep.
Well, as always, we appreciate your expertise and your time. Merry Christmas, Happy Holidays.
Thank you, you too.
Thanks for coming in today. Vice President of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. A lot more